Vermont, there's approximately 500 people living with HIV and AIDS. Our agency, the AIDS Project of Southern Vermont, served about 72 people living with HIV between Bennington, Windham, and Southern Windsor County in the last year. And the family numbers, where's Susan? How much? I forget.
Another
100 people? Yeah. Children, spouses, partners. Today we're here to focus on the bigger picture, a much bigger picture. Many wonderful things have been happening in the last 10 years in terms of treatment and funding and programs developing all around the world. But we must remember that there's much, much more to do, even here. Last week I was reading about people here who have been in treatment for many years now, developing a variety of different types of cancers, and we're seeing that in some of our patients. And we already know about heart attacks and lots of other problems that we're having with long-term side effects. But in other parts of the world, they're just beginning to get treatment, and many people haven't even gotten treatment yet. But it's happening more and more, and we are very grateful for that.
The Robotic Community Project is a project in a rural area in southwestern Kenya in the Nyanza province. It's one of the poorest provinces of Kenya, with approximately 25% of the population is infected with HIV or AIDS. And the Robotic Community Project was started by Timon Bondo. He's from the community, but hadn't lived in Robondo for about 30 years because he had moved away for school and been working. And he went back, and what had once been a flourishing community that was very self-sufficient was now suddenly devastated by AIDS. And not getting overwhelmed, Timon decided they would start the basic level and figured education was the best way to start, and educating the youth both in traditional school but also about AIDS and how it's contracted and how they can prevent it would be able to kind of get the community back on its feet. It now also includes a small health clinic, and that's for more of the basic needs of the students, especially treating malaria and some instances of TB, although it's not fully equipped to handle that. And they've now built another space for prenatal care and to address some of the health issues of those infected with the disease, because the closest access to healthcare that they have for treatment of HIV and AIDS and to get tested is about 100 miles away. And so to receive the medication or to get tested or receive treatment, most people would have to walk that distance, and of course that's pretty much impossible if you have families to take care of and so forth. And so right now they're working on bringing healthcare to the area. In terms of how it's affected the rate of the HIV in the area, they don't know, partly because no statistics were really gathered on how many people were infected before they started the project. But the biggest result that they've seen is the ownership of the community, and you have the youth that are now informed in how the disease is spread and are able to receive an education and improve not only their lives but the lives of the family and therefore the entire community.
I started working in the HIV field since 2002. I was working with the high school students in the prevention of HIV/AIDS, who were teaching kids on how HIV/AIDS is transmitted from one person to another. Because in my country, Rwanda, I hope many of you have heard about it, we had so many orphans of HIV/AIDS and so many orphans of genocide. So by the end of 2002, I started working with Dr. Susanna Granis to work with the orphans of HIV/AIDS. we had so many kids who had lost their parents, and in fact their parents, while they were still alive, they had sold out all their assets, all their houses, all their cars, everything. So we had so many kids on the street and the others with the relatives or friends, but many of them had dropped out their studies, primary and high school. So there was a small association of around 200 kids who were advocating for their rights, advocating for themselves because they were stigmatized in their communities, they were discriminated. So the most important thing we had to do was at least to provide the health insurance to those kids because some of them were sick, had HIV/AIDS, and the others had no health assistance. So we had at least to provide some health insurance to those kids. We had around 250 to one association. So then, as we got some more funding, we said, let us help some of these kids at least to go back to school. So, but as we started helping more kids, started joining association, we didn't have an idea of how many kids or how many orphans were around, the country or around Kigali. So the time I think I left, we had more than 2,000 kids only in one association. We were just helping. We couldn't reach to the kids, in their homes. Having more than 2,000 kids in different small houses, it was very hard. So we wrote a project proposal and we submitted it to Rotary Club. They were really very willing to help us. Basically, that's what we did for the kid, and there are so many other kids around the world who need help. There are so many kids and people who are around here in Vermont, so they need all of us to help them.
There are just literally now hundreds of projects like this all over Africa and Asia, and you hear about more programs all the time, and each and every one of them is responsible for saving hundreds of lives and for helping their communities grow and care for each other. And when we think about they talk about millions of dollars going overseas for HIV and AIDS, we really need to make sure that the money is going to the places it needs to go, to the people who are taking care of each other.